Migraines and me. Hi, I'm Dr. Jeremy Pont here from Townsville Spine and Sports Med, and today I'm going to talk to you about migraines. They're awful, they're terrible. If you wonder, have I ever had a migraine? If you have to ask yourself that question, you haven't, because they're not just like a normal headache. They are gargantually worse, and there's lots and lots and lots of different triggers to them, and there's lots of different types, and unfortunately we all wish that there was a cookie cutter solution for it, but it's not. Okay, so what I am going to try and do today is tell you guys what clinically we find helps, and later in the week, when we've got some more of our experts from around the world that are going to be telling you a lot more about what the medical, as in the prescription medications you can take, and also injections that are first, second and third line treatment. Now, what I'm going to tell you today is more about what I do, and I help patients particularly for their triggers. I don't treat migraine, I treat their triggers. And any chiropractor or osteopath, physiotherapist that's telling you they're treating your migraine is probably misspeaking, because it's not that they're treating your migraine, they're treating one of your triggers to your migraine. And one of the huge triggers that I see clinically is a headache, okay? In particular, what we call a cervicogenic headache. So that's when you find a headache that's coming from your neck or coming from your jaw that triggers that migraine, and so it sends a headache into a migraine. And now one of the things that we can do is try and really minimize how often you get those cervicogenic headaches by making sure your neck and your jaw and basically your whole upper body is moving properly as it should. Now, I've had patients that have had problems with their ankles that then have started to give them problems in their into their necks that somehow miraculously has helped. So my point for this is that it's really important that your whole neck and your whole spine is moving properly, okay? And if you find an osteopath, you find a physiotherapist, you find a chiropractor that can do that for you, good for you, okay? So we think of that type of treatment as more preventative. Now, I have in the past had very few patients, but had few patients that have responded really well as treatments being a treatment while they're having a migraine. So not before, but while they're having a migraine, which is few and far between. Fantastic for them, because suddenly they can just book an appointment with me and their migraine will go away, hopefully, where other ones have to wait to get a go over. Okay, so what we're going to do is talk a little bit more about what those other migraine medications look like, and I'm going to be employing some of the other members of my team and colleagues from around the world to explain that. But what I can do is I can help make sure that the trigger in your neck and your jaw is not there, so we can make sure that we minimize that chance of that headache becoming a migraine, or that jaw pain becoming a migraine, or that paradoxical breathing becoming a migraine. Okay, and sometimes and oftentimes I can help with that stress levels to make sure those stress levels sink down, which make it not go to the migraine.